So I'm down here in Costa Rica, and I recently did a post about medical tourism. So let's go through some of the nonsense comments I get repeatedly on medical tourism posts. And anyone who ever brings any concern about medical tourism gets these same comments. Let's talk about why they're nonsense. Okay, first one is complications can happen anywhere. Are you saying United States surgeons don't have complications? No, but your risk of complications is going to be lower with a well-trained surgeon. And when you don't know the system, you have a harder time vetting the surgeon, number one. And number two, if you do have complications, you are not in close proximity to your surgeon to help you manage your complications. And it's challenging to find someone in your home country that will take care of another surgeon's problems. Okay, next thing is that it's xenophobia. It's xenophobia. I'm in Costa Rica training on a technique for breast augmentation we don't have here in the United States. There's fabulous surgeons all over the world. We love them. We are in societies and attend meetings together. This is not xenophobia. It is a real legitimate concern when people are going to have cheap surgery in other countries and not properly vetting their doctors. That's a legitimate concern. And it's the same concern as if someone in Mexico was coming to the United States. If you don't know the system and you don't have proximity to your doctor, you have to be cautious. The third thing is that surgery is much, much less expensive in other countries, and that's why they're going there. That's not true either. So the surgeon here in Costa Rica, who is a breast surgeon, does the same kind of surgery I do. His prices for breast augmentation are the same as mine in Beverly Hills. They're the same. And that's just the reality. If you're going to a good, well-qualified surgeon in another country, they're not significantly cheaper than in the United States. And if you're seeing someone who is a tiny fraction of what you would pay in the United States, you're not seeing the best, right? You're choosing that surgeon because they're cheap, and that's not a good reason to choose a surgeon. You are trusting them with your life, your health, and your safety, and not a good reason to choose a surgeon. And then the last comment I always get repeatedly is someone who's claiming to be a nurse, always an anonymous account, claiming that they live in a border city, and they say that they never see complications from people that have surgery over the border. Right. Because if you have a severe complication, you are going to go to the nearest hospital, which is not going to be over the border. They're not going to ship you up if you're having a PE and ride you across the border. You're going to be taken care of there. And a majority of complications that we see don't happen immediately. They happen several weeks later. And so patients are going to be cared for closer to where they live, which is not the border city. So obviously you wouldn't see them. So make good decisions, make safe decisions, make decisions that bring you joy, but make informed decisions. And the concern is a legitimate concern. If you are from the United States, it is hard to vet doctors from another country. Their training is different, their certifications are different. Vetting a hospital, vetting a surgery center, vetting an anesthesiologist is more challenging than it is in your home system. And it's hard for people to do here at a baseline. Imagine doing it in some place where you don't speak the language.